Hello everyone, welcome back to our YouTube channel. I'm Dr. Sankalp Singh. Me and my wife, Dr. Swati Singh, we work at Yummy Fertility and IVF Center in Indore. And this is a series of videos of question and answer which we have started to answer the common doubts, common questions which comes to patients' minds. So today's question is, what is recurrent miscarriage or recurrent abortions and what can we do about it? So recurrent abortions or miscarriages, which is currently known as and correctly known as, is a condition in which a lady has 2 and more miscarriages. She's not having a healthy baby, but she's having a miscarriage, a pregnancy loss before 24 weeks of pregnancy. So that's a recurrent miscarriage. Now, there can be many reasons why a miscarriage can happen. But the most common reason is actually related to the chromosomal composition of the embryo. That is, if the DNA of the embryo is abnormal, more than 50% of abortions actually have the DNA abnormality as the main reason for the miscarriage. The other abnormalities, other problems includes issues with the uterus, issues with the blood in which your antibody levels might be very high. Sometimes the uterus has some abnormal cells in its lining which leads to a miscarriage. Sometimes it might be related to some fibroids which are muscle growth in the uterus, or any abnormal uterine architecture where there might be an abnormal structure of the uterus which can lead to a miscarriage. Also, the miscarriage can be due to the problems in the husband as well. So I've just put a few points pertaining to the wife's issue, what can be there. Also, it can be due to the abnormal sperm DNA, that is higher DNA damage in the sperms. That can also lead to a higher chance of a miscarriage. So there are tons of reasons about it. My suggestion is you should go to a doctor who will be seeing your file and then discussing with you what else could be the reason of the miscarriages which you are suffering. And then coming to the second part of the question, what can be done about it? So we need to do certain testings. In that, few are mandatory testings, like husband and wife should both have a chromosomal testing, that is known as karyotyping, in which we check all the 23 pairs of chromosomes in husband and wife and see whether they are normal or not. Second thing is to check for the uterus, whether the uterus is having an issue. So we do the 3D and 4D ultrasound which is available in our center. So we see the architecture of the uterus, whether the uterus is having a normal shape and size, whether there are fibroids, those are muscle masses, or any other problem in the uterus which can lead to a miscarriage. And if needed, some of the patient we might need to do a hysteroscopy, which is the telescopic examination of the uterus. So we put a small camera and a tube inside the uterus to see the inner part of the uterus, whether there is any problem in the uterine architecture which can lead to a miscarriage. Along with that, there are certain antibodies which are associated with miscarriage. Antibody means these are certain cells which are present in your own blood which act against your body. Those are antibodies. So it acts against your own body. So we do test for these antibodies to check whether any of such antibodies are present. You'd be amazed to listen that actually majority of the patient, more than 50-60% of the patients actually do not have any problem when these testings are done. So all these testings will still come normal. So what I would suggest you is that talk to your doctor. They will tell you what else can you do about it and how you can achieve a success. One suggestion from my side would be that you should go through a video which we have put up for a case series, on our case series video, case stories, where we had a lady who had previous 13 miscarriages. The link is in the description box above. So that particular video you should go through. I have discussed in detail about that patient as to what was the history of that patient and how she achieved a success. So I'm sure you'll find it helpful and that will motivate you, because she has previous 13 miscarriages, which is a humongous number. I'm yet to see a patient who has more than that many miscarriages. So I hope you would have found this video useful, and do let us know if you have any questions. Put it in the comment box. If you want to consult us, me and my wife Dr. Swati Singh, we both are working at Yami Fertility and IVF Center, Vijayanagar area in Indore. So please feel free to contact us for either phone, video or a physical consultation. Our details are given in the video. Thank you very much.